And now to give us insights on the emergency use approval of Sinovac's shot, we have Dr. Lulu Bravo of the Philippine Foundation for Vaccination joining us over the phone. Good afternoon, Dr. Bravo. What are the implications of skipping medical frontliners as the first in line to receive vaccines and move on to other demographics?
Yes, thank you very much, Sean. There was this EUA issued just this morning that Sinovac can be given to our actually frontliners, but not to health frontliners. It will have to be given to those who are not in the health, who are actually at highest risk of being exposed to COVID. I think it is because they're really limiting it to make sure that those who are at highest risk from being exposed to COVID are perhaps given a vaccine that could have a higher efficacy, having known that the vaccine has only 50% efficacy for health frontliners. But remember that this vaccine has a good efficacy as much as 85% for those who are in the other age group, like 18 to 59 years old, and are not at the highest risk of COVID. So I guess that is what the vaccine expert panel and our experts have come together, and they did their main recommendation. And to me, it is an important recommendation that we should follow. We do need to realize that it doesn't take just one person to do this recommendation. It takes a lot of our experts to make sure that the benefits of any vaccine will outweigh the risk.
That's right, Doc. But don't you think because it's not approved for medical frontliners that this would actually exacerbate vaccine hesitancy, or at least justify those who are hesitant against receiving the vaccine, which is, of course, counterintuitive to the inoculation drive?
Well, not necessarily. If you actually understand, as I said, what benefits mean outweighing the risk. Because from the clinical studies that have been published and that have been shown to our vaccine expert panel, it just shows that there is less efficacy for those who are at highest risk, those who are constantly being bombarded, so sure. And the efficacy here is 50%. As they said, what's shown in Brazil, right? But it doesn't mean that we cannot give it. As you can see, we are having a pandemic. Everyone can actually make use of a vaccine because having some protection is always better than nothing at all.
All right.
So this is how we will do it. If you do nothing, if you don't give vaccination, it will actually be difficult for us to also be able to control the pandemic. And the more that we can give vaccine to our people, the more that we can manage